Hi everyone, this is our final project. We are focusing on ACEs, also known as Adverse Childhood Events, and we focus on building resilience in students. So as we might all know, ACEs are linked to low academic performance, chronic health problems, mental illness, and substance use problems that affects us in adolescence and adulthood. And with that in mind, our problem statement is many children with unstable housing and or living below the poverty line experienced adverse childhood events and lack the support, the presence of supported adults in their lives and who can help attend to their needs. And we wanted to equip school faculty with skill sets and the confidence to address children's health needs and wellness in the context of ACEs, toxic stress, and or resiliency. To address our problem statement, we partnered with CREET Academy, which is a nonprofit charter school located in South Los Angeles, serving students in TK to 6th grade who are homeless and living in poverty. And our target group within CREET Academy was the faculty and staff who interact with these students the most, who face ACEs but lack supportive adults in their lives and no healthcare provider on staff at the school. For asset mapping for SPA 6, but CREET Academy is part of Los Angeles County Service Planning Area 6, which serves the communities of Crenshaw, Athens, Compton, Hyde Park, Glenwood, and more. And some of the institutions that we found that were notable were one, for example, USC, and there were actually 2 locations of CREET Academy within a few miles of each other. And there's also the Compton Woodley Airport, as well as some physical spaces like Exposition Park and Harbor Park. So due to a lack of specific statistics on childhood behavioral health and ACEs, we shifted our focus towards the stats related to mental health of adults aged 18 and older within SPA 6. So some of the data that we found were 59.1% of adults with current depression, they're actually receiving counseling from a mental health provider for the disorder, and 70.2% of adults are at risk for major depression, as well as 4 is the average number of poor mental health days in the past month reported by adults. And our analysis actually uncovered a significant gap in early intervention for mental health literacy in our geographic area. So considering this, we found some relevant data within the Healthy People 2030. And the first one being EMCD07, the goal was to increase the proportion of children and adolescents who show resilience to challenges and stress. The second one was to increase the proportion of children and adolescents who get preventive mental health care in school. And then the last one is to increase the proportion of trauma-informed early practices in elementary and secondary schools. So we recognize the importance of addressing mental health issues early, particularly in childhood. So we saw that there was a pressing need to raise awareness of ACEs amongst community stakeholders. So we wanted to find intervention strategies and support systems for children and families that are affected by ACEs. So we aim to prevent long-term mental health challenges as specified by the SPA Data 6.
So in terms of our needs assessment, we wanted to gauge the best needs for the school. So we actually had an interview with Erin Emanuel, who is the Director of Business Development and Wellness Manager at CREET Academy, with a few of these following questions that you guys see on this slide. So after asking these questions in this interview, it became really apparent that there is a significant portion of their students who experience high scores of ACEs. So in terms of our research to back up why we did what we did for our intervention, our first article kind of shows what we know, how adults who experience 4 or more ACEs have a higher risk of developing multiple chronic conditions and poor health outcomes overall. Versus those who have never experienced ACEs in the past. So we wanted to kind of emphasize the need for ACEs screening. Then the second article focuses on how mindful interventions have been shown to decrease depression, anxiety, alleviate trauma-related symptoms, as well as boosting coping abilities and mood. So we wanted to incorporate mindfulness trainings that can help counteract adverse effects of stress and trauma from childhood experiences so that we can hopefully improve both short and long-term outcomes and potentially reducing negative health outcomes into their adulthood as well. And then the third article shows how the traumatic childhood experiences can actually impair coping systems and lead to deficits in emotional regulation, and relationships. So, on the other hand, resilience fostered by positive adult relationships can actually mitigate these ACEs effects. So, we wanted to show the importance of supportive adults in these children's lives to help respond better to trauma. And our last article addresses the lack of education for pediatric residents on ACEs. So the study introduced a module focusing on ACEs, trauma-informed care, toxic stress, and resiliency. So before the module, the pre-survey showed low confidence in discussing these topics amongst the residents. However, the post-module data showed a significant increase in knowledge, confidence, and discussion frequency. So incorporating this, it sparked our interest in building a module to educate the faculty about ACEs so they can also increase their knowledge and confidence in these discussions. So introducing our intervention, we wanted to acknowledge the necessity of early intervention to prevent future health issues related to ACEs. So our module included the summary and overview of ACEs, toxic stress and resiliency, some practical tools and resources to cultivate resilience amongst the students. And also we wanted to make the module accessible and sustainable. So we created a recording available for staff and faculty for future training purposes. And some considerations that we had when creating our intervention. For health literacy, our group chose to write our needs assessment, pre and post test at a 10th grade level. We used SMOG readability formula on all of our questions to make sure it matched the health literacy of our audience, the CREATE Academy faculty. And to ensure cultural humility, we recognize that we do not fully relate to or grasp the realities that these students face in their own homes. And we acknowledge that we cannot comprehend the level of stress and challenges that these faculties actually face supporting these students and parents. We also connected with Dr. Brianna Gentile and Carissa Luckett from Center for Youth Wellness and saw insight of their expertise in communicating with teachers, parents of students experiencing ACEs. And through this, we were able to get some tools, testimonials to give to the CREATE faculty to have these conversations with the parents. And for trauma-informed practices, we wanted to ensure that we were not trying to fix their realities, but bolster their existing problems. We didn't want to push any agenda or knowledge, so we gave room for CREATE Academy faculty to chime in and partner with us to make the intervention better for listeners. Lastly, for equity and inclusion considerations, we recognize a potential bias that could exist within the ACEs questionnaires, especially against Black and Brown children. And we also understand that these problems are difficult to fix overnight, but a conversation that is encouraged to continue and incorporate the change.
For the advocacy portion of our presentation, we really wanted to emphasize on sustainability. So these are some of the screenshots of our module that we shared with the faculty, and we included practical tools such as stress busters to help the faculty build resilience, and then a video from ACEs Aware that Dr. Gentile from the Center of Youth provided for us. You could see Steve in the upper right-hand corner walking the audience through in this interactive module video. We provided different tools and interviews from experts to help encourage the faculty to have the conversations about ACEs, toxic stress, and resiliency with the parents and guardians regarding their children. We gathered different resources into a Google folder and shared it with the faculty. To evaluate the effectiveness of our intervention, we created a pre-test and post-test to see what the confidence level was for the faculty members before and after our presentation. The pre-test and post-test both included the same 6 multiple choice questions. The diagrams on the slide show our pre-test results on the left and post-test results on the right. We had 19 responses for the pre-test and 6 responses for the post-test. In analyzing our data, 2 questions showed a significant increase in the level of confidence. The rest showed a small improvement, but that could have been attributed to the fact that there was already a high level of confidence in the pre-test. In the first question shown here, we asked the faculty how confident they felt in their knowledge of ACEs, toxic stress, and resiliency. Prior to our presentation, 21.1% of the faculty felt very confident, and then in the post-test, 83.3% felt very confident in the knowledge. We also asked them how confident they felt in discussing these topics with students and families. In the pretest, we saw more variation, with 15.8 feeling not very confident and 52.8 feeling somewhat confident. In our post-test, no one reported feeling not confident in having these conversations with students and families. In our post-test, we also asked if they saw themselves discussing ACEs, toxic stress, and resiliency with families more, to which 83.3 said yes, so there was an overall more willingness to discuss these topics with families. We also asked how knowing about a student's difficult childhood experiences affected how they plan to teach and support them, to which one faculty member responded that they plan to allow their students to use the wellness center at the school more often.
Now, there's some things that we learned from this project is that there's a lot of training and resources online if you look for them. But there's not a lot of trainers who would go out into the campuses and teach the teachers and faculty about ACEs and how to deal with toxic stress. So it seems like there's a lot of need there. But there's one thing I realized that it really helped the teachers is just to be even aware about ACEs. Just that increasing that knowledge of ACEs helped them to really change their interactions with students. And we'll see how that goes in the future. But it's just like the same for us, where it's like trauma-informed care. When we learned about that, right, we realized that some patients might be triggered if we just put our hands all over them and do a physical exam without telling them. And it's the same thing here, it seems like, where the teachers are more aware that the students' behaviors might not be just because of their personality. It might be from their situation at home or things that they're going through at the household. So I think that was really a good idea that they shared this with us as well. So to reiterate, our objectives were to list out the ways about how ACEs can affect the child or the student's health and their long-term future. And not only that, how the effect of toxic stress can change the student's behavior. That is not just their personality or anything wrong that's going on, but it may be things going on at the home. And next is also about how the teachers and the faculty could at least start the discussion about ACEs and toxic stress with the students and their family. And we addressed those three topics by collaborating with Creed Academy to deliver them an educational module and resources to educate about ACEs, toxic stress, and tools to build resiliency. Then we also wanted to address and assess the knowledge and confidence about those three things. And we believe we did that with the pre and post test surveys as well. So a few obstacles. One of the things was just scheduling. We had spring break. They had spring break the week after. So there was a lot of delays about getting responses. But in the future, we could just, make sure that we get the schedule ahead of time and we could avoid that. And the next part was, I think, is the idea of realistic goals. They actually mentioned about some potential racial biases in ACEs questionnaires. And so we were interested on diving into that, but frankly, it was out of our scope. We didn't know how to go about doing that. So if we just focused on in the beginning, we could have just shaved a few weeks off here and there. The next part is that you saw the lack of responses. Yeah, I think it's hard to get people to respond to surveys. It's just nature of marketing and everything. But if we could have considered incentivization. That could have been a possibility. Or at least making sure those modules were performed during they had like these professional meetings where they helped teachers to develop and things like that on Wednesdays. So we could have perhaps had them do that a lot earlier if the scheduling it worked out. Fortunately, that was not the case. But I think next time we could just be more mindful about the timing. And lastly is that we were also waiting, hopefully, for the ACEs aware staff to come and teach. But again, the timing wasn't really there. So we just went ahead and then created our own module and then also gave them resources and referred them to the people at ACEs Aware so that hopefully later in the future, in the next couple of months, that they could be connected to them. So star wish. We were proud that we got the conversation at least started about ACEs and toxic stress to the teachers and faculty at Creed Academy. That if the teachers could give these tools or at least refer them to people who will help the students, then that's at least one, perhaps potential homeless student who can learn about tools to manage stress, and hopefully their health will be in a very good place in the future. So I think we were very proud at least to have that conversation started. The next part is that we also increase the confidence and the knowledge about the ACEs and toxic stress with the faculty. I think if we continue to add on that and build on that, then I think Creed Academy will be one of the best places that children could ever go to. Again, our wish was that, we couldn't address the racial bias, or we even mentioned BCEs, BCEs, beneficial childhood events. Is that was a little bit out of our scope. But hopefully later down the line in the future, if we have some more expertise, more time, resources, maybe that could be done. But I think that's the wish for now, that we could have at least just focused a little bit more and then address those when things come to be. And here are some references we used for our research. If you feel like you, a patient or a provider, could benefit from learning about ACEs, the toxic stress, and 7 ways to build resiliency, here is the QR code and the YouTube link below. So that's it for our presentation about ACEs and toxic stress. Thank you for listening to our presentation. And on the side, I'm just really proud to have known you and been with you for the past 3 years. So once again, thank you.